We are truly delighted to have the time with the most respected, one of the most respected medical scientists in the world. Dr. Soumya Swaminathan is here with us. She's a former chief scientist of the World Health Organization, former director general of the Indian Council of Medical Research as well, and a pediatrician who has spent 4 decades of work on child health, infectious diseases, health systems. Really couldn't think of a better person than you, ma'am, to sort of understand both what's happening in clinics and also in policy rooms. So let me begin by asking you this. For several years, you have been speaking about the issue of air pollution. We have been constantly covering it as well. Why do you think air pollution does not become an urgent health issue, say like COVID or TB? Why is it, now that we know that air pollution will kill more people than the pandemic ever did, than COVID-19 ever did, or even more than tobacco claims to be, taking lives of? Why is it that we don't see it as an urgent health problem?
No, thank you. That's a very important question. And I think there are a couple of reasons for that. One is, of course, that air pollution is something which is sort of invisible, though some days you can definitely see the smog. But even in cities where the air looks like it's okay, it's actually not okay. And you only know that when you measure and you look at the AQI and you look at the PM 2.5 and PM 10. So for most people, it may not strike them as a huge urgent problem. Second is it's slow. So you do have severe health effects from air pollution, but they don't happen overnight, unlike COVID, where you get sick right away, or you see people around you getting sick. And of course, a pandemic is something that creates so much of panic and fear. Whereas here, it is slow, it is invisible, it is acting on our bodies all the time, but it takes years sometimes to see the impact. Therefore, you don't necessarily make a connection between your exposure to air pollution and the health problems that you're facing today. So I think that's one reason. The second is that COVID, for example, everybody knew that it was a pandemic, it was caused by a virus, that the health department was in charge and had to act and was acting and so on, and everybody else was supporting. Here, the actions have to happen across many different sectors: industry, agriculture, transport, construction, solid waste management, indoor cooking fuel. And therefore, it's almost like a diffuse responsibility, and therefore it sort of gets diluted.
But talking about diffused responsibility, some people still think that pollution is a Delhi problem. Well, now we have decades of data really telling us very clearly that this is a North India problem. It's an Indian metro problem as well. So much so that 10 out of the 15 most polluted cities in the world are Indian cities. Do you think that narrative also needs to be specified, needs to be taken to the politicians?
You're very right. I would say that air quality or air pollution is a national problem. The reason is there's a lot of data now. Of course, we have many more monitors than we used to have in the past. And if any day you pick up the newspaper and look at the AQI from the different cities around, like today's newspaper, for example, I saw that almost all cities that were reporting were in the red. I've personally been in at least Bangalore, Bhubaneswar, Mumbai, Delhi, and Chennai in the last 2 weeks. And nowhere was the air quality anything that we could call good. So it's a national problem. It's a rural and an urban problem. The NCR region, for many reasons, gets a lot of attention and focus, particularly in these winter months, because there are also climatic variables which make the air circulation very slow and so on. But that whole Indo-Gangetic plain is impacted. And we have less monitors in rural areas. And so we focus on cities. In fact, our National Clean Air Program focuses on cities. And so we tend to neglect the rural areas. But I would say that 95% of the country does not have air quality according to whether, our own national standards, which is 40 micrograms per cubic meter, let alone the WHO standards, which is that it should be less than PM 2.5 should be less than 5 microgram per meter cube. So we're still far away from that. We need to have a stepwise approach, of course. We can't go from where we are to 5. But we can go to the WHO intermediate target, which is less than 35 micrograms per meter cube. But every millimeter difference we make will have an impact on our health. So it's really important not to get disheartened and say that things are so bad we can't do anything. No, we can do, and we can bring it down. And every little bit we do will show a good impact on our health.
Right. 95% of the country is not breathing good air. I think that's quite a figure that all of us should wake up to.